Good morning. I love to sing, but I generally do it in the privacy of my own home when no one else is there because I don't have confidence to express myself musically in public. But did you know that people who sing together have significant increases in their mood? They have higher oxytocin levels, which is the hormone that connects us together, and they have lower cortisol levels, which is the stress hormone. And that condition lasts beyond choir practice. It creates a durable impact on people's generalized mood and outlook. That's just one of the things that the sound health initiatives that the NIH has been funding for the past several years have been able to study and document. The initiatives that have come out of the NIH have involved 20 different institutes at the National Institutes of Health, which means it's a very multidisciplinary program. They funded some 600 projects in various parts of the country and are really starting to build the science of how music does influence good health. This is not something that's limited to adults. At the very earliest of ages, we now know that music is really helpful to neurocognitive development. It helps children acquire language and utilize words and language more effectively. It improves their ability to process information and manage stress in their world. For adults, if you listen to music in the perioperative period, you require less pain medication postoperatively. And even for the most senior people in our society, my uncle was one of them who had very severe Parkinson's disease, but dancing helped his movement. And when he learned to sing out loud, he could walk better. And we know from the science funded by the NIH that even if you're singing in your head, your movement is better and your muscle coordination improves. So we can see that music as a health intervention is something that is pervasive, and yet we're just touching the surface of what we need to know, beginning to understand the circuitry, beginning to understand the biology of how this unfolds, and I think really scratching the surface of how that translates into broader issues that should affect our investments in school art programs and other aspects of increasing more equity in access to the neuro arts. So I'm bringing this up because I do represent the Foundation for the NIH. We are a nonprofit organization that exists to help support the NIH work collaboratively with partners to raise money for things that taxpayers don't normally invest in, and to create innovative and convergent programs. And as Renée mentioned, the idea of training more neuroscientists to explore the relationship between music and the other arts and good health, and the importance of the practitioners of art therapy and music therapists, et cetera, to be able to use that science and translate it into interventions that really support and uplift people who need that kind of intervention. We're just at the very beginning of this, and we need more science, but we also need more scientists. So one of the reasons I'm here today is because I'm working with Renée and Dr. Francis Collins, the former director of the NIH, to try to figure out how we can build training programs in the neuro arts so that we can have more neuroscientists involved in this area, more music therapists or more art therapists involved in this area, and that we can help all boats float a little higher in our effort to really contribute in meaningful ways to solving some of the most important unmet needs that we have in our society. I always say that music is a gift, but it's also a social determinant of health. And what's been so wonderful about the experience that I had this morning at breakfast was hearing how in Los Angeles County there is this incredible collaboration on really, I think, maybe not labeling music as a social determinant of health or arts as a social determinant of health, but at least operating as if that were the case and collaborating across so many different kinds of organizations to really bring the arts to people as an important source of uplifting all communities in this county. So thank you for including me, and thank you for sharing the experiences that are really contributing, I think, to not just a better LA, but hopefully a better world. Thank you. It's now my pleasure to introduce Rachel Moore, who's the president and CEO of the Music Center. Thank you.